change daily and sometimes by the hour, it can be very difficult to find clear and relevant information. We've received a number of questions about people's concerns about COVID-19 and its impact on those living with epilepsy. We thought it was really important to come together as a community to give you as much information as we have right now to support you and your loved ones. We are so grateful today to be joined by Dr. Evan Cole-Lewis, a pediatric neurologist and clinical neurophysiologist, who is the director and founder of the Neurology Center of Toronto, and Ivana Yao, a nurse practitioner at the Epilepsy Clinic at the Hospital for Sick Children. And they will be speaking today to answer some of the most pressing questions that we have received. We want to make this webinar as useful and as interactive as possible, and we encourage you to type your questions into the Facebook comments below for the panelists to answer during the second half of our webinar. We will do our absolute best to address as many questions as possible. We ask that when you ask your questions, please do not share personal health information. Questions specific to your medical condition and treatment regimen are best answered by your healthcare team, but we would be happy to work with you after the webinar to help connect you with the most appropriate resources. Please know that today's session is also being recorded and can be accessed afterward on our Facebook page as well as our YouTube channel. So Dr. Lewis and Ivana, you both work in different clinical settings, and I'm wondering if you can speak to the impact COVID-19 has had on your clinics and patients so far.
Sure, yeah, I'll go first. Thanks, Christina. Thanks for the great introduction as well. It's a pleasure to be here to be trying to support the community at large and trying to help answer as many unknowns as possible. So, you know, this initiative from all of us thought was really important because in my personal practice, working with my epilepsy patients, there were a lot of questions coming up about how COVID-19 is affecting epilepsy in so many different ways. And I felt that I was addressing different questions to different people, and it was really important, I thought, to bring this more publicly so as many people as possible could have as much knowledge around the interconnection, if it's there, not there, how it affects epilepsy, how it doesn't, in order for everybody to kind of, more or less be on the same page, as this is an evolving time and a changing landscape for everybody here.
Yeah, well, thanks for having me as well. Like Evan, I've been getting a lot of similar questions, as have a lot of my colleagues here at the hospital. So just to preface this, like Evan and I are not infectious disease specialists, and our goals really here are to just reassure some of our patients, specifically when it comes to epilepsy and the worries around COVID-19. So we'll do our best. So at SickKids, like every other hospital in Ontario and Canada, they're monitoring the COVID situation carefully, and we're following the direction of public health. And so our number one priority is really to keep our patients safe and our staff safe. And so, as you can imagine, that means that things are constantly changing, and a lot of measures have been put to place to keep everyone safe. And so the biggest things that have been done are that we're switching over a lot of our clinical visits to virtual visits as much as possible. So a lot of people are getting calls about that. But at the same time, just know that your epilepsy team is still available by phone or by email. Unfortunately, the bigger impact has been that we've had to make really difficult decisions about postponing some tests and procedures and really limit this to urgent cases only. And teams are working really hard to evaluate this on a case-by-case basis. And so we understand that this can cause a lot of anxiety. So, we ask that you keep a close dialogue with your healthcare team and make them aware if there's any changes to your medical condition. So, because we are constantly evaluating these needs.
Just want to thank you again so much for both being here and for being so open to answering questions today and hopefully relieving some of the worries that are out there. We've gotten a number of questions asking about the risk of patients living with epilepsy and COVID-19. And I'm wondering if patients, both adult and pediatrics, are at greater risk for getting the virus.
Yep. So there is no greater risk to individuals, be it adult or pediatric, who have epilepsy, directly no greater risk to acquiring or being infected with COVID-19. Now, epilepsy is a broad term. It can encompass a lot of different underlying conditions. So, just as a kind of general cursory overview, no, if you have epilepsy doesn't per se mean that you are higher risk to contracting COVID-19 or acquiring COVID-19. But if your epilepsy condition comes or is due to or comes with any kind of condition that compromises your immune system, then you may be at greater risk. But that would be no different than any other medical condition that anybody else would have that would also compromise their immune system. So that's kind of a subset of individuals that might be at greater risk of getting COVID-19. But again, following prevention measures as outlined in Health Canada, as outlined in the Ontario Medical Association and other advocacy bodies, following these things like social distancing and practicing good hand washing and good hygiene overall in terms of cleanliness, that in itself will help reduce the risk of anybody, and especially those with epilepsy, of being infected with COVID-19.
Great, thank you so much. Sort of in a similar vein, if someone with epilepsy did contract COVID-19, would they be at greater risk of getting more sick than someone who doesn't have epilepsy?
Yeah, that's a really good question. So, similar to what Evan said, that we think that if you have epilepsy, but you are otherwise healthy, then your symptoms of COVID-19 are the same as anybody else. Some people who have epilepsy also have other underlying conditions, like Evan mentioned, and so in those cases, there might be more risk, and those would include things like underlying heart disease or respiratory issues or severe developmental issues. And someone who's obviously older and people who are on immunocompromised or on medications that would cause their immune systems to be weaker. But in general, I would say that I think even if you were to catch COVID-19, you should be able to reduce these flu symptoms with simple over-the-counter measures and good things like keeping yourself well hydrated and resting and sleeping well and eating healthy. All those things would help with the recovery.
Thank you. Would COVID cause someone living with epilepsy to have increased or worsened seizures?
Yeah, so it shouldn't directly. So again, there's no direct effect from COVID-19 causing an increase of seizures. That's been reported to date. So there's been some good data that's been reported by the medical community in China, who unfortunately were hit with this pretty hard and pretty early relative to the rest of the world. And so there have already been some studies that have looked at the effects of this from a neurological standpoint. And when we look at the neurological effects, there's not really, so it doesn't look like there's any direct effect of seizures being increasing in individuals. So the one study, it looked at about 214 people, and of those 214, they mentioned one individual that had epilepsy. That's what they said. So there's no details in the paper about what that meant or what that means. But outside of that, there's just mention of 1 in 214. So it's kind of hard to say what they actually meant. But overall, about 37% of those individuals had some kind of neurological manifestation. But those were mainly headaches. They were mainly kind of impaired level of consciousness, so confusion or tiredness or strokes that happened. And again, that was a small percentage of people. So there's really no data to say that COVID-19 directly has an effect on seizures. However, we have to take into consideration that COVID-19 is a viral infection. And we know with any kind of infection in individuals who have epilepsy, their seizure threshold can be lowered. So for sure, indirectly, COVID-19 could increase seizures in individuals with epilepsy, but that would be the same for any kind of infection anybody with epilepsy would have, or if anybody got sick for other reasons. So, just like we would counsel anybody who has epilepsy who gets sick, is to ensure that you're having, you have good sleep, make sure you're sleeping as well as you can, as Ivana mentioned, staying hydrated, eating well, and trying to keep stress levels down as well could also help during sickness in order to not have seizures be worse than they are at baseline. So again, to summarize the answer here, no direct effect that has been reported COVID-19 causing an increase in seizures, but there's indirect effects just by being sick in and of itself that could result in seizures getting worse.
Thank you. And we know that people are being advised to limit how much they should really be leaving their homes right now. Should clients be going to the ER if they're feeling sick or if they experience increased seizures?
I guess I could take that one. That's a great question. I'm assuming that if people are feeling unwell, this is in reference to them feeling like they might have COVID-19 symptoms. So if that's the case, then I would really refer you guys to the great Public Health Ontario website. In general, we are not advising people to go to the ER or call 911 unless you or your child is having difficulties breathing and have other severe symptoms, which are an emergency. And instead, we would advise you to click on, there's a self-assessment test on that website, and it will walk you through a bunch of questions, and it will tell you what to do next. And the general advice is really to self-isolate at home, which also includes not going to the grocery store or other place or visiting your friends, and treat the symptoms like you would with any flu like we talked about. If you're unsure, then I would say call public health before going into any assessment center or the ER, because we don't want you to risk actually catching the virus when you're there.
And thank you. Dr. Lewis, I'm wondering if you can speak to patients who maybe have scheduled doctor's appointments, or if they're thinking about scheduling a doctor's appointment, should they be doing so?
Yeah, absolutely, and they should. But obviously, we want to do this in a safe way. So we want to separate individual appointments as essential versus non-essential, and that's really hard, right? So I would say almost all medical appointments are essential because it's a relative, question for that individual. So, but what we can do about this? Most physicians have moved towards virtual online visits at this point in time. And especially neurologists and specialty physicians too. So that would be one thing to do. So don't cancel your appointments, call your doctor, ask your doctor if he or she is doing online virtual visits. If the answer is yes, then it's not a question. You continue with that if they're doing that. If not, and your physician is not providing those services, and for whatever reasons is providing in-person assessments, ultimately, that's going to be a question that you should discuss with your doctor, whether it's worth the risk to come out and expose yourself, given the nature of your visit. So I think that's a discussion at that point that one should have with his or her family physician or neurology specialist or whoever it is you're going to see. But in general, like I said, most people are doing virtual visits. At our clinic here, Neurology Center of Toronto, we converted over to pretty much 100% virtual, and those services are available for all our patients. And it's so far been pretty seamless in doing that, aside from a little bit of lag time on some of the visits, because I think most of Ontario is online doing video conferencing these days. But if you can withstand a little bit of technical slowing on your end, then it's a much safer way to do it, and is a practical and easy way to access care at this point.
So it sounds like, just to kind of sum up, that if you have a doctor's appointment scheduled, calling your doctor and determining whether or not that's an appointment that can be done virtually is best to start. And if you're feeling any type of symptoms of COVID, it's recommended that you don't go to the ER and really use that self-assessment tool and call public health prior to making any decisions about going to the hospital. That's great. So one question we've gotten a lot about is regarding anti-epilepsy medications and their impact on the immune system. I'm wondering if either of you can speak to that a little bit.
Yeah, I mean, that's a really common question that I've been asked as well. So I think the reassurance is that most epilepsy medications do not lower your immune system. And so there shouldn't be any weakening of your ability to fight off any kind of infections that way. So having epilepsy alone doesn't mean that you have a weak immune system at all. There are obviously going to be a few exceptions to this. So if you are taking medications like prednisolone or ACTH, which we use specifically for things like infantile spasms or other types of severe epilepsy, then in that case, you may have some weaker immune response. And in those scenarios, there's actually a really great website at SickKids that will have I guess, linked here, which gives specific information for patients who are considered immunocompromised and what to do in those cases. But I would say the majority of people are not in that category. And so that's, in that sense, epilepsy does not weaken your immune system.
Thank you. And Dr. Lewis, I'm wondering if you can just briefly touch on this issue for clients who are using cannabis as a form of treatment. Do we know if cannabis has any impact on the immune system ability to fight COVID-19?
Yeah, that's a really good question. Likewise, I do a lot of cannabis medicine for epilepsy at the clinic here, and that question's come up quite a bit with the patients who are using cannabis right now. There's a lot of myth out there, I think, in the general cannabis world about some of the things cannabis can do, some of the things that it really doesn't do. So first off, if you are using cannabis for epilepsy, it does not increase your risk of COVID-19. Okay? Likewise, it doesn't decrease your risk of COVID-19. So that's where I'm saying that, you know, you can find some things online right now where there are individuals reporting that it helps combat COVID-19. There's no evidence to support that at all. Okay. However, there is some basic science level evidence that does say cannabis has antiviral and antibacterial properties. Just because that says that, though, in those studies, doesn't mean you can translate that to it working against COVID-19. So really important, and I've tried to, and I've discussed that with many of my patients who are on cannabis because that comes up, asking about is there a benefit of epilepsy, you know, helping with my seizures and also helping fight COVID-19. So no, it doesn't. It doesn't do it either way. So likewise, though, one who is taking cannabis for epilepsy right now, you're very safe to do that. It's not going to make it worse. Or no, sorry, not going to make your chances of acquiring the infection any worse.
Great, thank you so much. We've also received some concerns from clients about difficulties in receiving medication on time. Can you provide any suggestions for patients to reduce any risk of medication delays?
Yeah, I think because in the past some epilepsy medications have been short, and so I think this is a very understandable fear that people have. So the good news is currently there are no epilepsy drug shortages reported at this time, and any drug shortages in Canada could be found on the www.drugshortagescanada.ca website, and so that's always a good one to check frequently, as well as the Epilepsy Toronto and other organizations which keep up to date with that. I mean, in general, I think the provincial and federal governments are working really hard with pharmaceutical companies to ensure that all Canadians continue to have access to their medications. But there are definitely a few things that I think we can all do to make sure we receive our medications on the timely manner. So I think the first thing is just to remember that, you know, we're all in this together, and epilepsy occurs in 1 in 100 people. So that's a lot of people that share the same resources. And so let's remember to be kind to one another and not stockpile medications. So what we would say is, please kind of keep track of your medications and how much you have, and give your healthcare providers like a 3 weeks notice if you're running low, so that they have time to refill your prescriptions and write new prescriptions to send off to pharmacies. Keep in touch with your local pharmacy team so they're aware of how many refills you have, and then whether or not they need to stockpile medication for you. And sometimes it takes some time for them to order in medications as well. And then, you know, be in contact with your healthcare providers. If for whatever reason there will be a drug shortage, your healthcare provider will be able to determine what's right for you and whether or not we need to switch your medications at that time.
I'm just going to chime in there as well, because I'll speak to cannabis too, coming back to cannabis, because that's also, you know, we can run into medication shortages with cannabis, and we're starting to see that just a little bit with some of the licensed producers. So the cannabis industry is a bit separate from kind of the pharmaceutical industry at this point in time, because you're not going to find that information listed, obviously, on kind of drugshortagescanada.ca. So if you are taking cannabis, I think longer than 3 weeks is appropriate. Almost check the websites every few days to ensure the oil that you're taking is still available, is not out of stock. Because if that's the case, it's a little bit more complex to switch patients oils in using for when we're treating cannabis for seizures, rather than kind of finding a way around some of the medications. So really important to keep in touch with the licensed producers, check their websites frequently to see where they're at. And if you notice that they are advertising that they are out of stock with some of these, then get in touch with your care provider to let them know as early as possible. Because again, it can be a bit tricky kind of switching between cannabis oils.
Okay, so for medications, clients really should be trying to order them and connect with their healthcare providers for about like a 3-week notice. And for cannabis, a little bit longer than that is recommended. And we'll make sure to put the drug shortage website into our Facebook comments so you guys have access to that and can check that. I think we're gonna go to Mackenzie, who's been moderating our Facebook comments, and there's been a lot of really great questions that have been coming in. So I think one of the first questions we have here are surgery patients more at risk for COVID-19?
I guess I can take that one.
Yeah.
So I'm wondering if this question is referred to people who are already had surgery or are waiting to have surgery. I mean, I think definitely if you are waiting to have surgery, we're in the same ballgame as everybody else. I mean, even those who have had surgery, depending on whether you're actually physically in hospital or not, certainly people who are in hospital and still receiving care, I guess, would be slightly more vulnerable just because we're in close contact with other people. But I don't think any more so than any other patient like we've talked about before. Maybe I'll just answer that other question that's related to epilepsy surgery. What is the status of epilepsy surgery? Is it elective? That's a really good question. So like I said earlier, we've had to make some really tough decisions about what's actually considered urgent and not urgent. And while we know that epilepsy surgery is important and can definitely change someone's quality of life very drastically, at this stage, we weigh like the risk and benefits of bringing somebody in the midst of this pandemic. And so for now, a lot of epilepsy surgeries are on hold unless patients are in status epilepticus or have epilepsy related to an underlying brain tumor or other things that we have to act on very quickly. But certainly that doesn't mean that you're not prioritized. And so as soon as we have the all clear from public health, we will definitely be re-triaging all the cases very quickly.
Great, thank you. I think the next question that we have received is, could a seizure be the first clinical manifestation of COVID-19?
So I'll grab that one, Ivana. Probably. I don't think that that's been reported as far as I know. I haven't seen that in any of the literature as being a presentation of COVID-19, but certainly kind of speaks back to what I think I mentioned at the very beginning, was that COVID-19 is just like any other kind of infection. So some people who have epilepsy respond to infections with an increase in seizures. And this can even happen, especially if you have fever-induced or you're susceptible to fever-induced seizures. Then with an elevating fever, one might have more seizures if they have an underlying epilepsy. So it certainly could possibly be that. But again, it also could, any kind of infection, coming back to any kind of infection, can also present with a seizure in someone who has epilepsy. So if you have epilepsy, again, the infection indirectly could cause elevation in seizure. That could be your presenting sign. Now, somebody who doesn't have epilepsy, could they present with a seizure? Again, that could be possible. If we look back to SARS and MERS, some of those individuals did have evidence of the virus going into the brain and affecting the brain, causing a condition which is called encephalitis. Anybody who has encephalitis could certainly present with a seizure. However, there's been nothing documented with COVID-19 that it does this, and there's even a debate. As Ivana importantly mentioned at the very beginning, neither Ivana or myself have any specialty expertise in the infection of the brain. So it would be a great question posed to a real subspecialist who does that kind of work. But from my understanding and what I've read right now, we really don't have any evidence that the COVID-19 virus goes into the brain and actively infects the brain. There's some hints, maybe it does. There's been some reports that people are presenting with loss of smell or loss of taste, which could be evidence that the virus is going into the brain and acting a bit on the brainstem or some of the nerves that do that. But again, none of this has been proven, none of this has been shown. And as far as I'm aware for the current literature, there hasn't been any defined or evidence that COVID-19 goes into the brain and can cause a seizure as a first sign in someone who does not have epilepsy.
Great. The next question that we've received are, what are the signs of an individual that has epilepsy has a weak immune system?
I mean, I guess going back to what was said earlier, I don't think there would necessarily be some overt signs that someone has a weak immune system unless you are taking medications that will suppress your immune system. So any kind of a steroid or a biologic medications that do affect specifically your immune system, then I would be taking extra precautions, but otherwise I wouldn't take on extra precautions like anybody else. People who are on those medications typically have maybe some low white cell counts or other things that they could easily catch an infection sooner than others. And so there are specific protocols with those patients in particular and lower thresholds in which we would say contact your healthcare provider sooner rather than later if you have even a slight increase in your temperature and things like that. So again, I would refer back to the SICKIDS resource, which is on children, and this could apply to adults as well who are immunocompromised.
If a patient isn't sure if their medication could impact their immune system, is it best that they just connect with their care provider?
Yeah, for sure. I think your healthcare providers are their best position to answer those questions because they know you and they know the medications you take. So yeah, please reach out to them if that's something that you're concerned about.
Thank you so much.
One thing just to clarify, I think I spoke to this before, maybe just around that question, just to be very clear, just because one has epilepsy doesn't mean you also have a weak immune system. So just to clarify what I meant when I said that initially, is some conditions that cause, so epilepsy just means a tendency to have seizures. And there are many causes for epilepsy. Some we have no idea and we never know a cause in some individuals. Other individuals may have brain injury or may be born with brain abnormalities. And there are thousands of conditions that cause epilepsy. So some of those conditions, especially genetic syndromes or metabolic disorders, may be also associated with an impact on the immune system. So those are the individuals I was kind of parsing out when I initially said this. But again, just to clarify, just because one has epilepsy doesn't mean they also have a weak immune system.
That's an important clarification. Thank you so much.
Yeah.
So the next question that we received was, I heard that those who are taking stiripentol would not be good candidates to take the malaria drug presently being touted to be a possible treatment. Can either of you speak to that? Yeah,
so that's quite a specific question. So stiripentol is a type of anti-epileptic drug used in various particular type of epilepsy syndromes. And the question here, I think more so really would be, they're talking, the anti-malarial drug that's been discussed that it might have some benefit in COVID-19 infections is really still being debated. And it's only being used in very severe cases where people are quite unwell. Those individuals who end up in hospital who are classified as severe cases of COVID-19. So I think that right now there's no evidence to support that that's the case. And if one happened to be in that situation, that would be a very case-specific discussion that would happen with a team, a dedicated team at that time. And it's something to pay attention to keep on looking out if this is actually an issue to be wary about. But again, I think the interaction is still questionable to some degree in all individuals, but also the use of the anti-malarial drug itself is still not actually being done throughout everywhere, and is still being debated whether that's a good treatment or not.
Thank you. So we received a question about, does taking extra vitamin D or B or C help to handle stress better or keep our immunity up despite taking anticonvulsants?
I mean, I think a lot of patients who are on anti-epileptic medications are already probably on vitamin D specifically, just because sometimes that can be impacted. And so I think there are some general guidelines on what our daily recommended doses are for all of these vitamins. So I would just follow those. I don't know if there's any evidence specifically about taking a certain amount that would help with your immunity in particular, but I think also there may not be harm. And so I would just recommend you talk to your pharmacist to make sure none of the over-the-counter medications, not just these vitamins, but some people take other types of supplements to make sure they don't interact with your epilepsy medications and to make sure that they're safe for you.
Thanks. And kind of coming back to appointments being done remotely, we had a question about whether the VNS device can be updated or increased remotely if appointments are being done virtually.
I'm going to kick this one over to Ivana.
Unfortunately, the current model, which is the most updated model, is still not able to be programmed remotely. So we do have to do those in person. Those are kind of the rare instances where we are asking patients to come in. We promise you that the visits will be quick and we'll make the adjustments as quick as possible. If you don't feel like you need an adjustment though, perhaps we could extend the amount of time between appointments so you don't have to come in as often. But currently, as of right now, the VNS still needs to be interrogated and adjusted in person.
Thank you. Is there any correlation between developmental delays and COVID-19 risk?
Yeah, I'll answer that one. So again, probably coming back to what I originally said, and it needs to be a theme, which is important now. There's no evidence that shows that COVID-19 risk increases with individuals with developmental delay. It doesn't increase the risk of having infection. Now, can it impact the developmental trajectory of that individual? Again, the question is going to be answered the same as any other kind of infection. Number one, it probably depends on the degree to which that individual would be affected. So if you have just a mild case of COVID-19, then there should be no impact. If you have a severe case and wind up in hospital with significant complications, then that could affect the developmental trajectory of that individual. But again, that would be the same for any other type of infection that that individual may or may not experience. And the other element I think to discuss about this is developmental delay in some people sometimes doesn't occur in isolation. So developmental delay can also occur with a lot of difficulty walking, difficulty talking. So one might not be able to express how unwell they are, and that might be an issue. So, this could be, perhaps an infection could go unnoticed for a few days. And again, but that would be a risk with any other type of infection. Another is if if an individual has severe developmental delay and is wheelchair bound and has other associated health issues that compromise the lung and the heart, then that individual could certainly be at increased risk of COVID-19 infection having impact on their outcome. So just as Ivana mentioned before, similarly to if a patient is on immune suppressing types of medications, those individuals and the people around them should take additional and extra precautions to make sure physical and social distancing is appropriately taken into consideration, and to avoid, again, trips elsewhere and good hand hygiene, etc.
I think similarly, since we are talking about other existing conditions, someone had asked, can having epilepsy and being diabetic cause you to have a weakened immune system?
So on one respect, first off, when it comes to talking directly about diabetes, and the impact on the immune system, I think I might be speaking for Ivana as well. It's probably best to discuss that with your endocrinologist and your primary care physician. They have much more experience than me with the direct effects of diabetes. So I wouldn't be so bold as to answer that as directly. But we do know, though, from the studies, especially the data published out of China, that having diabetes as an underlying condition did result in more serious cases of COVID-19. So I think those individuals might be slightly at increased risk. But again, I'm only quoting data that I've seen. I don't primarily treat diabetes, so I can't say that with a degree of expertise.
It sounds like it's really important for them to connect with their healthcare providers. Should clients use legal cannabis if there is a shortage in medication?
Oh, that's a great question. Okay, so I'm assuming legal cannabis refers to recreational cannabis. I'm guessing that's what that person is asking, because there's two markets of cannabis. There's the medical cannabis and there's recreational cannabis. So I guess what is being asked here, if there's a shortage of the particular oil on the medical side, can they substitute that with a product from the recreational side? Okay, number one, you should never do that, period. That if there's a shortage on the medical side, you should discuss with an individual who knows what they're doing in terms of medical cannabis management to help you find alternatives in the medical market. That would be number one. And if you're an adult and it just so happened you speak with your practitioner and there are no alternatives medically, then your practitioner will help you find something on the recreational side. If push comes to shove, we have to do that, then I think that's legitimate, but that should be in consultation with your physician who has knowledge and expertise in medical cannabis. Okay, big, huge point here though, okay? If this is a decision about children, we must know it's illegal to purchase cannabis from the legal recreational market, that's what the individual meant, and give that to a child. That's like going to a corner LCBO and buying a bottle of alcohol and giving it to your child. So really important. This is why the medical arm exists for cannabis, so we can monitor and we can do we can keep keep children safe who are on medical cannabis.
Absolutely. If an individual is early in their epilepsy diagnosis or has had several seizures but not formally received their diagnosis of epilepsy, and they do not have a specialist, what should they do?
Maybe I'll start this one and then throw it to Dr. Lewis after. I think that they should definitely speak to their healthcare provider. So that might start with a family doctor or a pediatrician who they are seeing, who often can make that diagnosis of epilepsy. Just keeping in mind that the diagnosis of epilepsy is really 2 unprovoked seizures, or having one unprovoked seizure and a strong underlying cause to have it that's associated with epilepsy. So most family doctors or pediatricians are also aware of this definition, but certainly I would definitely speak to them. And there's a new resource in town that I'll let Dr. Lewis speak to.
That was a nice a nice transition there. So that's great. So look, this is a serious issue, and this is not just a COVID-19 issue. This is an issue even prior to COVID-19, but one that I've kept a pulse on and have been very passionate about. And with the onset of COVID-19, I've seen this pressure mount, and have also anticipating that this is going to be mounting pressure on the healthcare system as a whole, making neurologists in general, especially epilepsy specialists, not as available. Clinics being offered in hospitals, not as available. So, I think we're running into a period of time where this is going to be stressful for individuals who have had their first seizure, or maybe have had events that they're uncertain are seizures and need to be seen fairly quickly. So for that reason, as Ivana just mentioned, at my clinic here, we've just designed the first ever kind of virtual epilepsy clinic. So this is a same-day appointment, walk-in style epilepsy clinic that gets you directly to a specialist. So what all the patients need is they just need to get a referral from their family doctor. So that can be done by a phone call or a video chat and say, hey, there's this same-day appointment epilepsy clinic. Basically, you go online through our website. Right before the clinic is running, you have a half an hour, and then through the clinic to register. You register online, you upload that referral, or have the family doctor or the nurse practitioner or a primary care provider, send in a referral, and you'll be seen the same day by an epilepsy specialist. And this is a perfect example of an individual who might need that right off the bat. So that's something we're piloting, and we started at Neurology Centre Toronto, and I think it's going to be a real valued resource for the community at large, and a way to just get rapid access for patients to have these questions answered early on.
Absolutely. I think that will definitely support access and reduce anxiety for families living out there. So we do have the link to Dr. Lewis's clinic in the comments, so be sure to check that out. I think this is one of our final questions. Do you recommend Tylenol or Advil to treat fever, pain management, or migraines for epilepsy patients?
I'm assuming that this is a question because there's been a lot of mixed messages about using Advil or ibuprofen with COVID-19 in particular. So there have been conflicting reports, and I don't think the evidence is yet out there, and the jury is out whether or not Advil is actually not recommended. But if you have alternatives such as Tylenol, we could definitely use that for fever. If this is in relation to migraines, that's not COVID-19 related, then I think Advil would be appropriate. Don't think that this would be, this is a question that's particularly directed to people who have epilepsy or not. So I think this is just a general recommendations overall, is that, if you have a fever, if you have Tylenol available, I would use that first, although there has yet to be concrete evidence to say that ibuprofen is not suggested.
And I would just add to that too, I also treat a lot of migraines in pediatric and adult patients, and I do treat a lot of patients with epilepsy who have migraines as well. And the migraines are treated just as anybody else, more or less, depending on what type of medications that individual is on and what other underlying conditions they have. So, again, I think this question is a little bit more specific. And if there are concerns specifically around, one is on a certain medication and should they use a certain medication for migraine, that sounds a bit complex. And, this kind of medium right now is probably not a great medium to address that specifically. So I would say talk to your neurology specialist or contact your family doctor to see if you can get a consult if that's something that you want to do.
Great. And our last question for today's webinar, based on what you are seeing, would someone be able to accompany someone with Dravet syndrome to the hospital if necessary, if they're experiencing severe symptoms of COVID?
That too, yeah, for the hospital.
Sure. I think if they're experiencing any severe symptoms, then I would definitely either call 911 and go to your nearest emergency room, which might be here at SickKids or in other places. It would be actually best if you could call ahead and tell them that, so that their team is prepared, because I think that's the best way to go. Here at SickKids, we understand that it's really important to have family to be some support, but we are restricting visitors, so we are allowing one adult caregiver to be with a child, and that's just to minimize the amount of bodies here at SickKids, amount of people, just to reduce infections. And I'm not sure what the policies are at other hospitals, but I can only speak to the one here.
Great, thank you. So I think we are really coming to an end of our webinar for today. I really want to thank our panelists, Dr. Lewis and Ivana, for your time and for your expertise in answering all of these really great questions. And I want to thank all of our viewers for joining in and asking your questions today. This video will be available shortly on our Facebook and YouTube channel, and be sure to check out our FAQ sheet that we are posting on Epilepsy Toronto's website as well. So next Thursday at 2 p.m., we will be continuing our live streaming sessions with Dr. David Gold, who will be talking about managing anxiety in the time of COVID-19. As well, I hope your children can join me and my puppet friend Lily, as we will be launching a weekly kids-friendly series on Thursdays at 11 a.m. So look for an announcement about that soon. So thanks again to everyone who joined today. Be healthy and be well. Thank you.
Thanks so much, Christina.
Thank you.
Thank you.
And thanks to Epilepsy Toronto for coordinating this. Just to echo, I mean, it's a fantastic organization. I urge all epilepsy patients or other individuals interested in learning about epilepsy, seizures, trying to help to touch base with Epilepsy Toronto and their local advocacy organizations. They're so important at this time where we need to come together as a community and really support and hold up one another.
Yeah, I agree.
Thanks so much, guys. Okay, take care.
Thank you.
Thank you.